So a possible cause of this may be as a result of genetic conditions. That is why, as a pregnant mother, you are advised not to take any drug of your choice. Before you take any drug, you must seek an advice of a physician or a doctor, so that you do not affect the formation of the fetus in your womb. Some babies who grow only one kidney may have a chance of developing irregular sex organs. We know that there are some other causes that may lead to this uterine diadelphys. This uterine diadelphys may have some irregularities. One of them is when there is a rare Mullerian dot anomaly. We know that the Mullerian dot is a dot that is supposed to come together to form a hollow organ, which we call womb. So if those dots do not come together or do not join properly, instead, if each of the dots should stand on its own to form a dot of its own, that dot of its own will be a womb of its own. Then the other as well will form a womb of its own. So it is an irregularity. Now, if they do not form properly to come together to form only one womb inside a woman, it may cause a pelvic pain. The pelvic will be paining the woman. If this pelvic pain condition continues, it may lead to blocking one of the vaginas. We know if a woman should have double dots, that is double wombs, it means that this person has double cervix, double vaginas. Another irregularity is cervical agenesis. Cervical agenesis is when a baby is born without cervix. Ani malo na cervix is an opening lead to the vagina. That is the cervix. So sperm will always pass through the cervix. The sperm can now reach to the fallopian tube, where the baby will now take its shape into the womb. Another irregularity is small kidneys. We know that some female babies that are born with only one kidney do always have irregularities in the formation of their sex organs. Another irregularity out of this uterine diadelphys is congenital vesicovaginal fistula. What is this congenital vesicovaginal fistula? This is when there is a dot between the bladder and then the vagina of a woman. If there is an opening between the bladder and then the vagina, that is when a woman begins to have a leakage of urine. The woman will no more be in control of passing urine. Instead, the urine will try to be passing out anytime the bladder is filled up with water. So it disgraces some women in the public. This problem known as congenital vesicovaginal fistula. Another irregularity is bladder atrophy. What is this bladder atrophy? Bladder atrophy is when a baby develops bladder outside of its body in the womb. It is an irregularity. Another is vaginal agenesis. This is when a baby is born without vagina.